Hello. In this video, we want to discuss the topic of what is professional counseling. The main purpose of this video is to help you get a better understanding of what is actually a counselor identity and the philosophy behind counseling. And this will help us to get a better understanding of what we would do in this profession as compared to other people who work in this profession as well. And so one of the main questions we want to answer first is what is counseling? And for us to do that, we want to make sure we come up with a good definition of counseling and be able to understand this topic that we're looking at. Well, there was back a few years ago, was a thing called the 2020 consensus. And this is where more than 33 organizations got together to try to create one universal definition of counseling. As a part of this group, we had the American Counseling Association, we had the National Board of Certified Counselors, we had CREDENTIALING, and also had Chi Sigma Iota, among several other organizations who came together to give us a definition of counseling. And so these groups met from 2005 all the way through 2013 to be able to establish a one strict definition of counseling. And this is what the definition they came up with was that professional counseling is a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. And I think this definition is really important because it is the backbone of what we do as professional counselors. And so what I did is kind of breaking this down a little bit and want to explain some of the things that we have underlined here. One thing, the first part that we want to focus on is the fact that this is a professional relationship. That as we get into the rooms with our clients, that we remember that everything we're doing is that we are a profession that has been around for a very long time, and because of that, that affects everything we do inside the counseling session and also the things we do outside of the counseling session. And so just like doctors, when doctors are in the doctor's office, and even when they're not in a doctor's office, they're still doctors. And so it's the same thing for us as counselors, to remember that there's a professional relationship that we do have with our clients, whether it's inside the office or outside the office that we meet with them in. And so there is a professional aspect to it. Another thing that it talks about is the empowering process we do for diverse individuals. And I think this is really important, that when we become counselors, and as we study become counselors, we have to realize that just about any time that we are working with people, people are going to be different and come from different backgrounds. They're going to look at things different from us. The perspective and viewpoint on life is going to be different. Their worldview may be different from us. And we need to be able to learn how to work with individuals who are diverse in many different aspects. And so it's important for us to be able to grow and to be able to stretch ourselves, to be able to look at things from a perspective different from our own. Because whenever we focus specifically from our own perspective, then we end up losing out ways of connecting with other individuals, especially when they are diverse and different from us. So whether it's an individual, as a family, or even as a group, we want to make sure that we empower each of these populations and also to honor the differences that they bring to the table as we work with them. Also, as counselors, we deal with mental health. That is our number one. One of our priorities that we have is looking at the mental health of the individual. Other professional organizations have other focuses, but our main one is looking at a mental health of the client. We also look at the wellness perspective as well, which we'll get a little bit more into as we go throughout this presentation. But we want to look at wellness, helping this person to live their most optimal life they have, which is more of a global perspective and looks at several different aspects of this individual's life. Also, we do a lot of education as a part of counseling, that we are able to teach coping skills. We're able to help our clients to understand maybe some topics that are deeper that they may have never been exposed to before. And so we want to work with them through this whole education piece as well. And also career goals, that sometimes for individuals, the main reason they're coming in is because they're having a big time trying to figure out where they need to go with their life, and especially when it comes to their career. And so we step in as counselors to help them with their career goals. And so whenever we think about counseling and we think about all the different things that we do, there's a reference to this. This is a professional relationship. We look at our mental health, their mental health. We look at their wellness, the education, and also the career goals as looking at from a holistic perspective when we're working with clients. Another thing we think about is the philosophy of counseling. And one of the things we have to remember that this is a helping relationship. And now I've underlined the word helping there for a main reason. A lot of times people would think of counseling as a thing where we are doing things for our clients, but the reality is that we're walking alongside them as they begin to work out some of the issues that they have coming in for. And so we want to make sure that we realize that we are there to help these individuals and we walk alongside them throughout whatever thing they are dealing with. And this is our primary focus of what we do. We deal with their psychological healing, whatever that may look like, their own growth, and looking at that. When it comes to looking at changes they may have in their life, we want to be able to work with them on that, and the development of the client as well. And so one of the main things as we look at this primary focus is that we want our clients to have healthy relationships, just not only with themselves, but also to have healthy relationships with other people. So if they have low self-esteem, for example, we want them to be able to work with them to look at themselves differently. Or if they have problem communicating with other people, or whatever the case may be, we want those relationships, all the relationships they are a part of, to be healthy, and we work with them through that to get them to that place in their life. And so this is going to look different regardless of depending on the client that you have that comes in front of you. And so the issue of change comes about quite a bit, and also the developmental process that each client is going through. We want to focus in on that as we're working with them as well. And so this is our main philosophy: is that we are we are there as helpers to the individuals we work with, because the relationship that we have with them helps them to grow. But we want that growth to be internal with their own self, but also external, and be working with the relationships they have with people outside of just us. Another philosophy of counseling is that this is intentional. That this is not a casual relationship that we have with anyone else. It's different. It's structured. There are boundaries that we have when we work with clients. There's certain things we can and can't do, but it's a purposeful engagement that we have with our clients. So that when my clients come into the office or wherever I meet with them to talk about whatever is going on in their life, I engage them in activities that I've taken some time to choose for them to help that client to grow in whatever area they have. If there's a place where they need to have some healing, I want to work with that. Or if there's some places of development they need, then I'm going to give them some things to work on that area as well. But we're very intentional about that. And the reason why I think this word intentional is so important is because we don't want to be in a place where with our clients where we're simply just coming off of things off the top of our head and going with our gut in every single thing that we do. Now, we'll talk about that here, intuition, in a few minutes. But what we're talking about here is that I'm very intentional with the clients that come in. So if I'm working with a married couple, I'm intentional about that. I want to look at relationship patterns, different things like that nature. If I'm working with someone who's dealing with trauma, I want to try to make sure I'm looking at the background that they come from and the traumatic experience they've dealt with and how it's been dealt with in the past, things of that nature. But as I walk into that session, I've done research, I've done homework, I prepared for that session, for that individual, because I want my interactions with them that day to be something that was intentional and not just something that happens by accident. And so this is what makes our relationship different with them, where it's different from a friendship with them, it's different from a coworker, it's different from an acquaintance. This is an intentional relationship with the goal of helping them to grow and develop in their life. Another thing we look at is the fact that what we do is ethical. I love talking about ethics. Not everybody enjoys talking about ethics, but the reality of it is that because we are working with individuals and they're telling us their story and we're engaging with them at this deep level, we need to make sure that our helping behaviors that we have adhere to some type of moral and ethical and professional guidelines that we have, and that these are provided by professional organizations and also by the law. And so these are just helpful for us. And so the reason why we have these is helps us to know how far can we go in sessions, what are the boundaries that we have when we work with clients, what are the boundaries that clients need to respect when it comes to us, and it gives a basic standard of care that we need to use. And so we want to make sure that we follow the ethical guidelines that we have in front of us, also the professional guidelines that are given to us, and also abiding by the law that we have as well. And we'll talk about this more this week in class. But one of the things we realize that sometimes that ethics and law may not always match up with each other. They may sometimes be in conflict. But the reality of all of this is that our ethics, those are things that help guide us as professionals in this profession that we have chosen to be a part of. And so part of our philosophy is that we do things in an ethical manner. Also, we realize that as we look at the philosophy of counseling, that counseling is an art and a science. And let me explain that a little bit. The science part is a part that you pick up in school. Those are the skills that you learn. That's the books that you read, the evidence-based practices, different things of that nature. And those things are important. So it's important for you to be able to pick those things up and to learn from the scientific perspective of counseling. But there's also an art to counseling because each of us end up approaching counseling from a different perspective, and this may not even be necessarily even be connected to your theoretical orientation. It just may be the way in which you carry out counseling and the way you end up dealing with people as therapists. And the neat part about counseling is that this is something that changes over time. That the science of it, in general, that we'll see some shifts in science, the scientific part of counseling, as new theories and different things like that. But the art of counseling develops and grows over time. You know, in my personal background, I've been a therapist for well over 15 years now, and because of that, when I began being a therapist, there were certain things I did from the artistic perspective of that I've now grown in. I do significantly different now, and that helps me to become what I think consider a better therapist because of that. Because the art part of me, the art, the intuition that I've gained and grown over the time has changed. And so, as the slide talks about, there's an intuition that we grow in, like knowing when to speak. That sometimes it's always the best time to speak. Sometimes there's a good time when we need to be silent. Or when do we intervene in a situation, and when do we back off and let go? And so with our intuition, we learn, we grow with this. So as a new therapist, we may be a little bit timid about listening to the intuitive part of ourselves, but as we grow as a therapist, this part of us begins to grow as well, and then we're able to see that we can actually able to do things now that you may not have been comfortable doing as a younger therapist or as a newer therapist. And so counseling is an art and a science. They both balance each other off very well because it helps us to be able to appreciate and to understand the book knowledge that we have, but also growing in the skills that we have, which is the art part. And putting those two things together really affects the way in which we work with our clients. So when we think about counselors, we ask the question, what do counselors bring to the table? And the reason why I ask that question is because when it comes to working with clients, sometimes what clients want to hear is what is the most comfortable for them, and that may not necessarily be what's best for them, just to hear what they want to hear. And so one thing that we bring to the table is that we bring reality and insight. That since we're an outside party, we're able to help clients to be able to see things from a perspective that they're a little bit blind to, because we are not engaged in the situation they are in, and we can give them an outside perspective to that as well. And also we can bring them a reality portion to this too, where we're able to look at it from as an outsider to a certain extent, and be able to help them see the reality of their situation. Now, sometimes people say, well, why can't they go to a good friend? And why can't a good friend help them out? Well, The reality of that is friends are too close to the situation, and because they're so close to the relationship already, that sometimes they're going to lack insight, and they can't really show the reality of the situation because they're too their viewpoint of it is very, very subjective. But we can be objective because we can stand back from the situation and be able to see what's going on with the client. Also, we look up at this therapeutic relationship and working alliance that we have with the client. We talk about rapport and how we build this relationship with the clients where we, uh, we're connecting with them on this level where we want to help them to see the growth process begin to happen. And so we call this a working alliance because there's a part that we do as therapists, and there's a part they do as clients, and we do this together. And so, as we do this, we want to make sure this is something that we're both working on together, and it's not something where I'm walking in and I am just saying, hey, that I'm just guiding and directing everything. That I'm actually sitting back and I'm working with the client, so we can have a good alliance to be able to find out how do we get to a certain part or place in their life to help them to get them to do the things they need to do. And so this therapeutic relationship is super important because once again, it goes into this working alliance that we have with the client where we're working in unison with them towards the goals that they've identified versus us going in there with our own ideology of where we think the client's life needs to go. Also, there's some characteristics of being an effective counselor. Empathy. In that the word empathy, we hear quite a bit. Where sympathy is basically me feeling bad for someone, feeling bad for what happened to someone. But empathy is where I put myself into that person's situation to be able to see how would I react to that situation based on trying to be, or based on everything this person has told me and me trying to really see what life looks like from their perspective. So it's one thing if I see someone fall down a flight of stairs and they get hurt, I can say, "Oh man, that's bad. That stinks to be them. They hurt." But then if I put myself into that situation, trying to figure out what would that feel like if I was that person, what would that feel like emotionally and physically to go through that? And so for me, that's how I kind of differentiate between sympathy and empathy. There's been times where I've worked with clients who are pregnant women who end up losing a child. And so from a sympathy standpoint, I can say, okay, that's bad. But from an empathy standpoint, I really have to I really had to dig deep and be able to say, okay, what does it feel like to be a woman who has lost a child, and what does that feel like? What could that possibly feel like? And the only way for me to be able to step into that client's world is for me to be somebody who is empathetic. And so sympathy is really it's from being on the outside world, where empathy is where you enter the client's world. Also, acceptance. Acceptance is a really big thing for counseling. Is that we accept people where they are, and that's one of those things where we take ourselves out of the picture there, but try to accept a client for wherever they may be in the spectrum of life. Where you may have someone who is sent in because they're court mandated to be there, or you may have somebody who was caught in an adulterous act and they feel like they have to be there, or whatever the case may be. But we find ourselves being accepting of our clients and not being judgmental. We simply are there to be in the moment with them, and so that is very, very important skill for us to continue to grow. Also, just being genuine. And this is one thing I talk about quite a bit is making sure that you are genuine with your clients when we talk to them about the things that's going on in their life. People, from my user experience, I've noticed that clients have the ability to see whether or not you're being genuine with them or not. And so whenever you are able to be yourself and to let your personality shine through in the counseling session and to just be open and honest with them and just be genuine with them, they're a lot more likely to connect with you with someone who they feel like is being disingenuous with them. And there's lots of different statistics out there, but the important one really talks about the fact that clients tend to connect better with people who they feel like they have a good relationship with. And so if I've got the empathy, I've got the acceptance, if I feel like that if the client feels like I'm being genuine, they're lot more likely to connect with me regardless of my theoretical orientation that I have. Also is the wellness perspective, which we talked about a little bit already, where we are looking at this client's wellness in general. And so we want to make sure that that perspective is a part of what we do as we're working with clients. And an effective client counselors look at wellness as being an important part of the client's life and try to work with them to complete that wellness they're looking towards. Another thing is just cultural competence. And this is one of those things where we are continuing to grow in every single day, where we're trying to learn, how do I work with people who are different from me? How do I look into the life of somebody even though I've never stepped into their shoes before? And so growing in cultural competence is one of those things that each of us as therapists do, as counselors do, that we'll continue to do until we stop doing counseling. And so it's one of those things where you can't just take a class in it and say, hey, I'm culturally competent. This is one of those things where you continue to do research, you continue to go to presentations, you continue to get education to learn as much as you possibly can about becoming, in this process of becoming culturally competent. Because when you walk into a room with someone who's different from you, you need to know how to approach that. Also, it's just the it factor, just that factor that we bring to the table that they cannot be taught. And I think everybody has that it factor when it comes to counseling. Like I said, once again, it may be your personality, it may be the way you approach people, it may be the way that you listen. I think all of us have different ways of being able to do that. But there's something about each and every person that's a therapist or a counselor that helps, that they have an it factor that makes them unique in this counseling profession. Also, we have counseling theories that you end up using to be able to work with clients, regardless if you're coming from Gestalt or CBT or whatever the case may be. We all have theories that we are coming from and we use, so we make sure we're actually helping the client from a known theory, and that way we have a place to be able to help them know how to get from place point A to point B, because it's built off a certain theory that we have. Also, there's competence, and this is just the fact that we work with clients who we have the skills and ability to be able to work with. And this is once again something that you're going to be growing in. Maybe you are stepping into counseling and you're saying, you know what, I want to work with kids, and so that's great. So you need to grow in your competence of working with kids. And so knowledge is one thing, just knowing about it is one thing, but actually having the practice and skills and doing it over and over again help you to grow in the competence that you have. And also this cognitive complexity, and this is where you're able to work with clients and be able to read them, to me that's a part of that cognitive complexity, because sometimes we're working with clients who've been through some really deep and stuff in their life, and so when it's cognitive complexity piece, we want to make sure that we're able to be able to look at these concepts that they are bringing to the table and be able to read through those to help them to be able to work to the place where they need to be in their life. And so those are just a few of the characteristics of what we consider of an effective counselor. Also, we can continue. We talked about theories. You'll work on your skills as well. Tools and techniques, you'll be gaining a lot of those during your time period, during your intensive that you'll be doing. But also the professional responsibility that we have of the ethics and laws and the cultural competence that we will all be bringing to the table together. And so as we think about being a counselor, these are the things that people bring to the table as counselors, and it helps us to be set apart from the other professions that are out there. And it's an important part of what we do as we work with those people who come in who are hurting and those who are looking for guidance in their life. And I think Corey puts it very well here. What Corey says, if practitioners possess wide knowledge, both theoretical and practical, yet lack human qualities of compassion, caring, good faith, honesty, realness, and sensitivity, they're merely technicians. And that is something we don't want you to be. We don't want you to be merely technicians. We want you to have compassion. caring, good faith, to be honest and realness, and then to become sensitive. And so that's part of what the whole counseling program is all about. The other thing we look at is for things that we believe as counselors, once again, is this wellness perspective. And the goal here is to strive for optimal functioning. And so, and when we look at optimal functioning, we're not trying to get rid of the problematic. Our main goal is not to get rid of the problematic symptoms that are going on, but we want our clients to actually strive for optimal functioning in life and health in life. And so, if we're just taking care of symptoms, that's that's okay, I guess. But at the end of the day, symptoms change, and so we actually want to get down to the root issues of what the person is dealing with, and get them to the place where they have optimal functioning in their life. And so that becomes very, very important. Part of that optimal functioning is going back, to Maslow's hierarchy of needs. I know you've heard that before. When we begin on that base level, where people get to the place where they are self-actualized, and that's important for them, and that becomes part of this wellness perspective. And also from Carl Rogers, we want them to be fully functioning when they leave from working with us. And so this wellness perspective becomes very important. Also, not only is there a wellness perspective, but also a developmental perspective. And this is where we want our clients to be responding to activities, responding to events in their life, and having normal responses to abnormal events. And this is going to be based on the age level of the client. And so when we have clients who come in, we want to make sure that what they are dealing with matches up with where they are developmentally. So, for example, if someone comes into my counseling office and says, hey, I have a 2-year-old and they are very possessive and they're saying everything belongs to them and they're stubborn and they cry a lot. Well, that's a normal response for a 2-year-old. And so developmentally, that child is where they need to be. They're meeting certain standards for where they need to be at that age. But if this is what someone who's 45 years old, they can't do the things that they're supposed to be doing at that developmental place, then we need to make sure to help them to get there. And so there's a developmental perspective as well that we're looking at, that we want clients to get to the place where they have normal responses to these abnormal events, but also realize that these transitions can encourage our growth. And so as we work at this, and so there could be transition issues that they have in their life they're going through, or whatever the case may be. We want to be able to help them to work through these things to get to a place of full functioning. Also, cultural difference, and the slide talks about how every client brings a unique background and history, and I guess the easiest way to say that is everyone has a story, regardless of their sexual orientation, regardless of their gender, regardless of their race, regardless of many cultural differences. And we need to be able to realize that because of that, because there are cultural differences, there's ways we have different ways in which we have to approach our clients because of that. And so we have to be respectful of these different stories that individuals are bringing to us as they walk in, they come to see us for therapy. And so every client brings a unique story to the session. And we need to be there willing to listen to it unbiased, to listen to it without being judgmental, because we want to make sure they feel safe in the environment that we're provided for them. Also, there's this aspect of empowerment of the client, where we want to encourage them and foster independence. And I think that's the word independence is a key thing here. I feel like one of the main goals of therapy is that at some point I want my client to be at a place where they feel like they don't need me anymore, where they don't need to work with me anymore. Some of the best cases I've had is when clients will come in and tell me, I think I'm finished now. And I'll ask them why they think they're finished. And they'll go through and talk about what they came in for, and the counseling that we've done, and then where they are at this point in their life, and how they feel like they can start doing things on their own. And for me, that is great. We want individuals to be independent. We want them to be able to function and to be able to make these choices in life without feeling like they have to have the approval of a therapist to do certain things in their life. And so that's what we look at as empowerment. And I believe there are some times where we sometimes foster an unhealthy dependence on therapist, from the client to the therapist, and we want to stay away from that. We want our clients to get to the point where they are independent, and so we want to encourage them in that. Also, we look at counseling as being proactive and preventative. That we are there to educate as we work with them, and so that makes us all, in some aspects, teachers as we enter into the room. There's topics that we have knowledge on, that we've studied, that we want to be able to share with them, and this is not to make them believe what we believe, but we want to be able to offer them alternative perspective, and this becomes an education piece for them. So some people do that through books or other types of resources, but the more proactive we can be about situations before situations happen, it helps. It helps so this problem does not get too big down the road. And so we try to be proactive and preventative when it comes to counseling. And also, the thing we talk about the most is the counseling relationship, because this is the cornerstone of everything that we do. That we can do all these other things well, but if we don't have that relationship with that client, if they don't feel safe, if they don't feel like they can tell us things that are important to them, then they will not return back to see us anymore. So that counseling relationship becomes a real big piece and cornerstone of everything we do in counseling. So one question that comes up quite a bit is, what is the difference between what we do and other professions? Because we realize there are other people in life who do things similar to what we do, but their jobs are not exactly the same. And so we want to talk a little bit about how do counselors differ from some of the other professions. And so one profession specifically is social workers. Social workers, when it comes to getting licensed and advocacy and social justice issues, they have been the trailblazers in that area for a long time. This is a profession that's been around for a long time. And so because of that, they do a lot of great work when it comes to advocacy of clients and also social justice issues. Now, this isn't to say that counselors don't do this as well, but when it comes to looking at who's the trailblazers in this area, social workers definitely are when it comes to dealing with social work, when it comes to the social justice issues. Social workers tend to focus more heavily on identifying and addressing systematic barriers that are going on in society. And so when they see situations like homelessness or whatever the case may be, they try to get together and try to figure out how do we work through this system to help these individuals get the resources and things that they need, because they want to focus on helping these barriers to come down, and so people, and helping people to be able to work through these social issues, so that those things will not be in their way anymore. And so they're very good at resources. Now they do therapy as well. They do provide mental health therapy as well. But I think that one of the biggest things, the difference between us and them, is just that focus on social justice and their focus on also addressing systematic issues and barriers in our society. Next is what we have are psychologists. Now, depending on the state that you're in, you either have to have a master's degree or sometimes even a doctoral degree in psychology to be able to practice psychology. A lot of their training for psychology does come in inpatient facilities. They sometimes do it more severe psychiatric disorders. A lot of them do counseling as well, but a lot of psychologists also do a lot of psychological testing as well. And so that, once again, that kind of differentiates them from us. And so a lot of times psychologists will focus more on a medical model, where that's what we're dealing with. They deal with it more with the symptomology, where we as counselors working on the wellness and developmental perspective of the client. So once again, it's not necessarily a bad thing. It's just different from what we do. Now, the third group we have are psychiatrists. Psychiatrists, these are individuals who have gone to medical school already. They are doctors, medical doctors, and they have gone through training in mental health, but not as. But I know this for a fact that they don't have as much training in mental health as you do as a mental health counselor. One big thing you see with psychiatrists is they do see clients on a regular basis, but they also do the writing of prescription drugs for clients, usually psychiatric medication for clients. And so that's one of the main things that make them different between from what they do and what we do is that they are medical doctors. They do provide counseling, but one of the big things they do is they spend time with, I would say, more severe clientele, but also the fact that they're able to prescribe medication makes them and sets them apart quite a bit. Now, life coaching. This is something that is not brand new, but it's still relatively new when we look at life coaching. And basically, what life coach, I think the easiest way to explain what a life coach is they don't really deal with mental health issues in general. That's not what they're trained to do. What life coaches do is they try to take individuals from one point of health or of their life being good to making their life being better. So let me give you an example of that. And so let's just say in my functioning in life, I'm functioning at a 7, where 10 is the best and 7 is where I'm at right now. And there's certain things and certain specific goals I'm trying to work on that aren't really mental health related, but they're still giving me some problems from being able to live my life fully. And so sometimes individuals will go to a life coach to be able to work through these issues so their life can go from that 7 up to that 10. And so these are individuals who work with people, but once again, they do stay away from mental health issues. Now, there are individuals who do life coaching, and it can be done at several different levels. Some life coaches have bachelor's degrees, some have master's, some have doctorate degrees, and some have just simply gone through certification. And so, life coaching is one of those things where it's still a developing area of interest for many individuals. When you look at social workers, psychologists, and psychiatrists, they have their own code of ethics. They have licenses and things of that nature that you have to be able to practice that. But for life coaching, is one of those things where it's a little bit different, where there's not a real set code of ethics for life coaching. I know there's several different organizations that do training to become a life coach, but it's one of those things where a lot of people are starting to be a part of, but it is significantly different from being a mental health counselor or being a counselor, because they don't really deal with any mental health issues. Now, when it comes to counseling, there are several different types that are out there. Personally, I'm what we call a clinical mental health counselor. We have those who are school counselors. We have a marriage and family counselor as well. We also have student affairs and college counselors. These are people mainly work in higher education to see clients there. Then we have addictions counselors, and those are individuals who can be trained at different levels with different levels of experience. And then we have rehabilitation counselors, and these people work on the physical, emotional, and developmental disabilities that people have, and that's what their main focus is on. And then we have pastoral counselors, and these are people who use spirituality and religion specifically in what they do to help them to work with individuals. Now, the interesting thing about these different type of counselors, it's possible for you to actually be more than one type of counselor at the same time. But once again, it goes to deal with it has a lot to do with the training and education that you do. So for some people, they may be a clinical mental health counselor and also be licensed as a marriage and family counselor, or they may be a school counselor and also be licensed as a clinical mental health counselor, or mix in some of these other ones as well. And so the best part about this is just helping us see there are a lot of different type of counselors that are out there. And because that it helps us to see that we have a very broad range of things that you can do with the degrees that you're getting to help you to be able to help individuals who are having problems and things in their life. So one of the main things we want to talk about and look at is this professional identity. That it's important for us to know that we are counselors and proud to be a counselor. Because when we have a good professional identity, that helps define us forever. My father tells everybody that I'm a psychologist. I'm not sure why. Nothing against psychologists, but he's been telling people for years, my son's a psychologist. But I'm not, though. I'm a mental health counselor. And so there's a difference between what I do and what a psychologist does. And that's why professional identity is so important, because it defines for me, and it also defines for the public, what it is that I do. Also, it unifies us, because it gives us a place where we can come together as a profession to work towards to bringing positive change in our society. And also, if there's negative things that are going on, it helps us to be able to unify, to be able to fight against those things that are happening in our society as well. And so it's a unification part to that as well. Also, it protects us, because with our professional identity, we get this thing called a scope of practice. And it helps to give us boundaries on the things that we are able to do and things that we're not able to do as well. So there's a big protection factor that goes on with us having this professional identity. So when someone says, I'm a counselor, they know what that means. And so it helps me to differentiate myself between other professions. And now I'm able to be protected, so people won't expect other things out of me, because they know that I am a counselor. And it also advances us as well. We have organizations, which we'll talk about here in a few minutes, who are out there lobbying on our behalf to make sure that we are being able to get the most that we possibly can get with the degrees that we have and with the licenses that we obtain as well. And so having this professional identity is important, that when we walk away, that regardless if we are mental health counselors or we're school counselors or we're marriage and family counselors, whatever the case may be, at the end of the day, our professional identity says that we are counselors. And that's what's important. And then it does all these things for us, where it defines us, unifies us, protects us, and then also advances us. Now, as a part of us having this professional identity, there's professional organizations that comes along with that. And so because of that, well, there is professionalism that we have to have. Because when it's professional, whenever we don't act in a professional manner, it has the ability to have issues that can impact our clients, but also impact as counselors as well. So there's professional organizations that are out there that help us as counselors to make sure we're doing the things we need to. These professional organizations also put out journals on the latest research on different theories that are out there to help us to make sure we're practicing with stuff that is researched. Also, just the practical information that we get on how to act as professionals, and also the current trends that are going on as well. These professional organizations help us to stay up to date with that as well. Also, when it comes to ethical practice, there's ethical, our ethical expectations would not exist unless we had professional organizations. So it's important for us to know what these ethical obligations are, but these come from our professional organizations. And so it's important for us to make sure that we do join and be a part and be an active part of a professional organization. And we'll talk about that here in just a couple of minutes. Also, for advocacy, professional organizations get together and they advocate for the profession. And so if I'm one of those people where I'm wanting to see change happen, especially in my organization, part of that means I need to get involved with that, because these groups are a part of advocacy, and they're wanting to see things happen and change for us. And so that's the important part of that as well. Also, there's licensure and graduate programs that without these professional organizations, we wouldn't be able to have the licenses that we have, because they help to mold and shape what we need so that we have the license we need to practice. And also, these professional organizations help us to know what type of things need to be taught in our graduate program. So, for example, CREP becomes a very important part of everything that we do at our university, and it helps to define what we do as a counseling program and as a graduate program. And so as a professional organization, it's important for us to know what they stand for and how that benefits us because of these professional organizations. And a lot of times with the professional organizations, there's a lot of benefits and services you get from it. There's conferences that they have throughout the United States and also internationally that you can go through. They have journals that you are able to read to stay up to date on what's going on the current trends. If you have an ethical situation, they have ethics hotlines that you can call into to help you to find out what you need to know about that. And also access to malpractice insurance. If you're a member of certain professional organizations, then you end up getting discounts to the malpractice insurance you need to practice as a counselor. And so being a part of a professional organization is super important, regardless of what type of counseling you are practicing, because there's so many benefits that come from being a part of the professional organization. Now, for our program specifically, we follow and we are bound by the American Counseling Association, and that's who we end up following. And so the American Counseling Association is the largest association for counselors in all specialties in the United States. There's more than 40,000 members of the American Counseling Association. They have two journals. There's a magazine called Counseling Today that comes out from them that you're able to get if you're a member of American Counseling Association. And also they have the Journal of Counseling and Development, where it's a research journal to help you keep up on trends that we see happening. And so as we talk about our program, we talk about ethics, things like that. The American Counseling Association is the ethics that we usually go back and talk about the most, because that's the one where it's kind of the biggest branch of what we end up following. Now with the ACA has divisions and it has regions. So for regions, there's four main regions that it has. There's a Midwest region, there's a North Atlantic region, there's a Southern region, and there's a Western region. And so these are just basically where they have basically taken the larger national association and broken it down into smaller regions. And there's leadership and representation at those regional level to help give support to the state divisions that are out there. And so we'll talk about that, the state divisions, here in a couple of minutes. Also, there are divisions. There's 18 different divisions of the American Counseling Association, and these become very important. These divisions help us to be able to specifically hone in on specific parts of counseling that are important to us. So if we are important, if military counseling, for example, is important for you, there's a division of American Counseling Association for that. If multicultural counseling is important to you, there's a division for that. If you are a counselor educator, want to become a counselor educator or a supervisor, there's a division for that. If LGBTQ issues is something important for you, there's a division for that. So there are 18 divisions out there that are part of the American Counseling Association, and these divisions help us to get more education and research on the specific things that bring passion to us and what we want to do. And so it's important for us to have those divisions. And so those divisions, once again, with the division, they give us more time to spend time with the passion that we're working towards, and also for in the work setting that we're in, we may be a part of a specific organization, or part of that division of the American Counseling Association. Now, with the regions, there's four main regions of the American Counseling Association, but there are branches as well. And where we have branches in 50 different states, but also there's Latin America, Europe, DC, Puerto Rico, the Virgin Islands, and the Philippines as well, where they have local branches of the American Counseling Association. And this is, to me, I think is a really important part, and it helps us to be able to see that whether it's at the state level, whether it's at the regional level or at the national level, you have people working on your behalf to see change happen in the counseling settings. And so my encouragement for you is that even as a student, to go ahead and get involved with the American Counseling Association and get involved even at the state level, to get involved there, and you're able to see things happen. I know that we have had multiple of our faculty who have been very active in the state levels of American Counseling Association, and so I think this is one of those things where we see as being very important, and so we want to see our students see that as being important as well. Now, also when it comes to our profession, we want to look at the components of credentialing as well. that as we are working towards our licenses, one of the big things for us to realize is in order for us to be a counselor, there's an education piece that we must deal with. The big part of the education piece is realize that must become a master's level practitioner. And that means that in order for us to practice in this field, we must have a master's degree. As a part of that master's degree, we have a core curriculum that you go through. So whether you're going through school counseling, whether it's mental health or the marriage and family track, there's a core curriculum that you must follow to be able to show that you have competence in those areas. On top of that, you have supervised field experiences where you'll be doing internships and practicum, where you'll be working with individuals in a real life situation, so you can get practical experience working with these individuals before you end up graduating. And also on top of that, we have the accreditation of CREP. And what and basically what that does is that what CREP does is it accredits counseling programs so that whether or not I go to a school in Arkansas or Tennessee or Pennsylvania or Hawaii or whatever the case may be, CREP has given standards for counseling that all these programs would end up following if you want to be CREP accredited. What that does, though, is helps in so many different ways. And so what it looks like is, so whether I take those classes at any of those schools that are CREP accredited, even though the topics that may change a little tiny bit, the core content of everything being taught is still going to be the same regardless of which school you go to. And that's why it's important for that to have that CREP accreditation that we do have. Now, once you have all that education and everything, then we go to what we call state licensure. And this is going to be something that's different in every state you have. Your state's going to be looking at your education that you have. Once you graduate, they want to know about your postgraduate supervised hours. Once again, that's going to look different depending on the state that you live in. There's also testing requirements that on certain on certain exams that you may have to take in order to get licensed in your state to practice. And then once you get finished, you get a bunch of great letters behind your name to show that you are a counselor. And these letters are going to be different depending on what state you're in. And so for Pennsylvania, for example, it may be LPC. In Arkansas, it may be LPC. But in Maryland, it may be LCPC. So this is going to look different depending on what state you're in. But all these things basically mean the letters behind the people's name helps them to see that you're licensed in a state. But then also, not only do we have these state licensures, we also have national licensure. And these come through the National Board of Certified Counselors, where you can become a national certified counselor. You also can become a certified clinical mental health counselor. And they have several different certifications that you can go through that are recognized on a national level to help people to show not only that do you have a master's degree and that you also licensed in your state, that you've gone well beyond that to get specialized training on a national level as well. And once again, that just helps to make you more competitive in the job market that you're in. So as we kind of wrap up this presentation and kind of focus on some of the things we talked about, one question we need to ask ourselves is, what draws you to counseling? And I think for each one of us, that's going to be a different answer for us. That one thing or another brought you into this program and brought you to the place of wanting to become a counselor. And so, well, as you kind of ponder about this, what values, beliefs, experiences have led you to the counseling field? I hope you take about 5 or 10 minutes to kind of ponder about that and think about that, because I think, at least from my personal perspective, is that understanding the reason why you want to get into this is really going to help you to push you through this program and and continue to stay in the counseling field in general. Because when you don't know what values brought you here, if you don't know the beliefs that brought you here, if you're not really sure the experiences brought you here, then counseling becomes a job. And from my perspective, this is not a job. This is a calling. This is a profession that we're very proud of. And so because of that, we need to know what was that. You really need to know what was that brought you into doing what you're attempting to be working on these next couple of years in the program. So what draws you to counseling? Well, I want to thank everybody for listening to this presentation. I hope that it gave you a better perspective and understanding about the counseling profession, about why our identity is important, and helps you to understand a little bit more about why we are counselors and what a counselor actually is. Hope you all have a great day.